Picture a waiting room. Someone coughed, then they left. An hour and a half later, you walk in. Nobody's there. You touch nothing. You talk to no one. But the virus is still in the air. That's measles. The CDC says it can survive, airborne, for up to 2 hours after an infected person leaves a room. 2 hours. And right now, in 2026, measles is back in America. Not just back, it's exploding. I researched what scientists are actually finding, and what I found genuinely shocked me. Stay with me. As of May 28, 2026, the CDC has confirmed 1,983 measles cases in the United States, 40 states, 30 new outbreaks this year alone. And here's something most people don't realize. This isn't just a kid's disease anymore. A quarter to a third of all cases in 2026 are adults over 20. Johns Hopkins researchers confirm this. Adults getting measles in 2026. And the CDC has already warned more cases are coming. Summer travel season is here. But the raw numbers aren't actually the scary part. What scientists discovered about what measles does to your body, that's what we need to talk about. To understand why this matters so much, I need to give you a quick history lesson. In 1963, the measles vaccine was introduced. Before that, 3 to 4 million Americans caught measles every single year. Hundreds of thousands were hospitalized. Hundreds died. Then the vaccine changed everything. By 2000, the United States officially declared measles eliminated. Eliminated, gone, done. We beat it. That was 25 years ago. In 2025, we had the worst measles year since 1991, and 2026 is already on pace to be worse. What happened? I'll tell you exactly. But first, I need to tell you about something scientists discovered that changes how we think about measles entirely, something that wasn't in the headlines. Here's what I wasn't expecting to find when I started researching this. Most people think of measles as a rash, a fever, a week in bed, you recover, it's over. That's what I thought too. But scientists have discovered something that changes that picture completely. Measles doesn't just infect your respiratory system, it attacks your immune system itself. Specifically, it targets your immune memory. The cells that remember every virus and bacteria your body has ever fought, every infection you survived, every vaccine you ever got. Measles finds those memory cells and destroys them. Scientists call it immune amnesia, and the research, published in Science Journal, found that measles can erase up to 73% of your immune system's memory. Let that sink in for a moment. A disease you survive can leave your immune system in the state of a newborn baby, and that vulnerability can last for up to 5 years. Let me explain how this actually works. Your immune system has what you might call a filing cabinet. Every time you fight off a disease, flu, chickenpox, COVID, whatever, your immune system creates memory cells. B cells and T cells. These cells remember the enemy. So next time that pathogen shows up, your body is ready. Instantly. That's how vaccines work too, by the way. They train your immune system to recognize a threat before it ever appears. Now, measles virus doesn't just sit in your lungs. It goes hunting for those memory cells. It infects them. It destroys them. And when they're gone, your filing cabinet is empty. All that accumulated immunity from years of vaccines, years of surviving infections, gone. Nearly every unvaccinated child who gets measles can be impacted, said Patricia Stinchfield from the National Foundation for Infectious Diseases. Not some children, nearly every child. And here's what this means in real life. A kid survives measles, recovers fully, feels fine. 3 months later, catches a regular cold, but their immune system can't fight it properly anymore. Hospitalized. This is what researchers found when they looked at measles-affected communities. For 2 to 5 years after measles, those communities had dramatically higher rates of other infectious diseases. It's not a coincidence, but this gets even stranger because immune amnesia affects adults differently. I know what some of you are thinking. Okay, but COVID was way worse, right? Let me show you something. COVID has an R0, that's the number of people one infected person spreads it to, of about 2 to 5. Measles, R0 of 12 to 18. If one person with measles walks into a room of unvaccinated people, 90% of them will get infected. 90%. COVID at its worst was about 30%. Now, COVID's death rate was roughly 1%. Measles kills 1 to 3 children per 1,000. Lower, yes. But here's the difference. COVID doesn't erase your immune system afterward. Measles does. And then there's the brain. 1 in 1,000 measles cases causes encephalitis, dangerous swelling of the brain. But there's also something called SSPE, subacute sclerosing panencephalitis. It's a brain infection that can develop months, sometimes years after measles. It's progressive, and it's almost always fatal. A child gets measles, seems fine. Then a year later, starts having seizures. I know, it sounds like a horror movie, but it's real, and it happens. And here's the part most news articles are skipping over entirely. This is the part I want you to really pay attention to, because if you're watching this, you're probably an adult. And adults have a complicated relationship with measles immunity. Here's how it breaks down. If you were born before 1957, you almost certainly had measles as a child. Natural infection, full immunity, you're likely protected. If you were born after 1989, you probably got 2 doses of MMR vaccine in childhood. You're almost certainly protected. But if you were born between 1957 and 1989, you might have gotten only 1 dose, because before 1989, the CDC only recommended 1 dose, and 1 dose offers about 93% protection, not 97%. That gap, in an outbreak, can matter. And here's what Johns Hopkins researchers found this year. 1/4 to 1/3 of all measles cases in 2026 are in adults over 20, not children, adults, people who thought they were protected. So let me ask you a direct question. Do you know how many doses of MMR you've had? Do you know for sure? Most people don't. And that uncertainty, right now in summer 2026, is actually dangerous. Because summer travel season means airports, concerts, crowded places, and the CDC just warned that more cases are coming. So how did we get here? How did a disease we eliminated in 2000 come roaring back in 2025 and 2026? The answer is actually pretty simple. Vaccination coverage fell. During the 2019 to 2020 school year, 95.2% of American kindergartners were vaccinated against measles. By 2024 to 2025, that number had dropped to 92.5%. That might sound small, but measles is uniquely unforgiving. To stop measles from spreading, you need at least 95% of the community to be immune. We slipped below that threshold, and measles noticed. The KFF Health Tracking poll this year found something striking. Almost 20% of American adults believe that getting the measles vaccine is more dangerous than catching measles itself. I'm going to say that again. 20%. 1 in 5 adults. That belief is not supported by science. The MMR vaccine has been given to billions of people over 60 years. Its safety record is extraordinary. I want to be very clear. I researched this extensively. The science on MMR is not ambiguous. But I also understand why trust has eroded. The last several years did a number on public trust in institutions. I get it. I really do. And I'm not here to lecture you. I'm here to give you the actual data and let you make your own decision. What I will say is this. The data is very clear on one thing. Every 3 cases of measles prevented in 2025, 1 required a hospital visit. 11% of patients were hospitalized. 3 people died, all 3 unvaccinated. Here's something that's going to happen in November 2026, and most people have no idea. A body called the Pan American Health Organization, they're the ones who track measles elimination status across the Americas. They're going to sit down and officially review whether the United States still qualifies as measles-free. Canada went through this last year. They lost their elimination status. The United Kingdom lost theirs. 5 European countries lost theirs. Now it's America's turn. Researchers at CIDRAP, that's the Center for Infectious Disease Research and Policy at the University of Minnesota, published an analysis saying it's highly likely the U.S. will lose its measles elimination status this fall. Now, what does that actually mean for you? It doesn't mean you're automatically going to get measles. It means something more systemic. It means we've failed to stop domestic spread for 12 consecutive months. It means the infrastructure that was keeping measles at bay is weakening. It means the risk is higher than it has been at any point in 25 years. And there's one more thing I need to tell you, something that specifically concerns people in your age group. In 2025, measles killed 3 people in the United States, 2 children in Texas, 1 adult in New Mexico. All 3 were unvaccinated. The outbreak that year started in a small community in Gaines County, Texas, a Mennonite community where roughly 20% of children were unvaccinated, compared to the state average of under 4%. From that one community, measles spread across the American Southwest, eventually reaching 45 states. In 2026, public health experts are already warning, can we expect another death? Yes. That's Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia, one of the most respected infectious disease physicians in the country, not a scare tactic, a statistical reality. I want to pause here for a second, because I know this is heavy. A lot of you are parents, or grandparents, or you're thinking about your own kids, your own grandkids, going back to school in the fall. So let me give you something practical. 3 things you can actually do, right now. Here's what I'd personally look into, after doing all this research. Number 1, find your vaccination records. If you were born between 1957 and 1989, you may have only had 1 dose of measles vaccine. Ask your doctor whether a 2nd dose makes sense for you, especially if you travel. A blood test called a titer test can actually measure your level of measles immunity. This isn't something most people know about. I didn't either until I researched this. Number 2, if you have children or grandchildren under the age of 12 months, babies that young can't receive the MMR vaccine yet, the CDC recommends that the adults around them be vaccinated. It's called cocooning. You protect the baby by protecting everyone around them. Number 3, know the symptoms. Measles starts like a bad cold. High fever, runny nose, cough, red eyes. 3 to 5 days later, the rash appears. It starts on the face and spreads downward. Here's the critical detail. You're contagious for 4 days before the rash appears, meaning you can spread measles without knowing you have it. If you suspect exposure, call your doctor before going in. Don't just show up. Measles can linger in a waiting room for 2 hours after you leave. The doctors know this. They'll tell you how to come in safely. And one more thing about your own indoor spaces: good ventilation matters, open windows, air purifiers, especially if someone in your home is sick. It won't stop measles if you're directly exposed, but it reduces the risk in shared spaces. Let me leave you with this. In 1963, a scientist named John Enders helped develop the measles vaccine. He'd already won the Nobel Prize. He spent decades trying to eliminate measles from the planet. By 2000, the United States had succeeded. That was one of the great public health achievements of the 20th century. In November 2026, in a few months from now, a panel of international health experts will sit down and decide whether America still deserves to be called a measles-free country. What they decide depends on what happens between now and then, on whether transmission chains are interrupted, on whether vaccination rates climb back above 95%, on decisions made by parents, by doctors, by communities. I'm not here to tell you what to believe. I'm here because I spent hours going through the actual research, the CDC data, the Johns Hopkins analyses, the papers in Science and Nature, so you don't have to. Measles is not a rash. It's not a childhood rite of passage. It's a virus that can erase up to 73% of your immune system's memory. It can cause fatal brain damage years after you've fully recovered. And right now, in the summer of 2026, it's spreading across 40 American states. Know your vaccination status, talk to your doctor, and if you found this video useful, share it with someone who might need to hear it. I'll be back soon with another deep dive. Take care of yourselves.